people hate drug companies, and they hate them for a very simple reason. They're horrible. And here to talk about that with us now, but perhaps in a little bit more depth than the analysis I just provided for you, is Sean McElwee. You may know Sean's work. He is a prolific writer as well as the co-founder of Data for Progress, a think tank that advances and studies progressive issues and the popular opinion around them. And Sean has just co-authored a piece with Nancy Altman of Social Security Works on the fact that, well, I'll let him speak for himself on their survey work in this area. So first of all, Sean, thanks for coming back on the program.
Thanks for having me.
Oh yeah, always a pleasure. And let's start with this. You guys did polling on the drug question, and what'd you find?
Absolutely. So working with Social Security Works, Data for Progress polled a wide number of pharmaceutical reforms that would affect drug prices. We found all of those to be quite popular. The most popular was public disclosure of the costs and funding sources of research and development for new drugs, and Medicare negotiating with pharmaceutical companies. And you know, the least popular ones were we had one policy that was prohibiting advertising direct to doctors for pharmaceuticals. But even that was the least popular one, and we still have that at a strong sort of net positive plus 20 support. When we're talking about policies like negotiating with Medicare, we're talking about plus 70 support, which means that that's enough to have strong majority support among Democrats, independents, and Republicans. But we didn't stop there. We asked people about these specific policy planks, and then we did another thing, which was we said, what's going to happen after these issues are sort of partisanized? What's going to happen after the pharmaceutical industry pays for advertisements to make these issues unpopular? So we did two things. First off, we told people in the survey that these ideas were being proposed by Democrats, which was designed to reduce sort of support among Republicans. And then we gave them arguments that the Republicans were making, and we did not do weak arguments. For example, I'm reading one and we said, this will reduce the incentives for companies to invest in new innovations, ultimately resulting in fewer life-saving drugs. In another instance, we told people that this is a waste of taxpayer money. The government can't run a Department of Motor Vehicles correctly, much less manufacture drugs. And what we found is that even after those arguments, compulsory licensing, which is a policy that allows companies to make generic versions of a drug that currently has a patent, so it essentially breaks the patent, had net positive 33 support and majority support among the general public. And the government manufacturing drugs on its own had net positive 10 support. And to put that in context, we've run a lot of issues this way where we've had the sort of partisan queue and the arguments for and against. And what we tend to find is that those issues tend to be around -2 to about +4 for sort of a generic Democratic proposal. So both of these policies are polling dramatically higher than a generic Democratic policy would poll. And even after the Republican and Democratic messaging, they are still net positive among independents. So we're making a strong case that this is an issue that even after voters hear both sides, even after they see advertisements that are paid by the pharma lobby, this is still not something that's going to be costing us votes in a midterm or a general or a presidential.
Yeah, and first of all, Sean McElwee, you know, I'm glad you made those closing comments about context, because I look at a fair amount of polls myself, and 5% net positive, 10% net positive, that's good. So the weakest case here in terms of the various alternative policies does very well at 10%. When you start talking about 30% up to 70%, and when you talk about your counter arguments were extremely well phrased, when you start talking about their kind of resiliency that this support has against very well phrased Republican counter arguments, the kind that are very effective sometimes in undermining support for other policies, you're really talking about, I mean, this is not an analytical term, so I don't use it a lot, but you're talking about kind of mind-blowingly good results. I mean, that's my takeaway. I don't know if you agree that mind-blowingly is the proper analytical term to use, but that was my first reaction.
Yeah, absolutely. So one of the things that I think, indicates that these results are not anomalous is that Gallup every year does a survey of industry satisfaction in terms of how much do people trust different industries. And this year they just came out with their newest ratings last month. And pharmaceutical companies are the lowest trusted industry in the country. So we have a lot of independent reasons to believe that attacking pharmaceutical companies, attacking pharmaceutical profits is going to be an effective tactic. And I can say, there are a lot of progressive issues that I think absolutely need to get passed. I think there are a lot of progressive issues that absolutely have support. But there are not a lot of progressive issues that are going to have support in a deep Trump district. But I would say that we can say with a lot of confidence that if there is going to be a message that is going to allow Democrats to resonate in a district that Trump won by, say, 10 points, 15 points, the issue that they're going to be wanting to talk about is they're going to be wanting to talk about pharmaceutical companies because that is something that voters absolutely despise. And voters believe that the solution of allowing more competition is very effective. This is sort of the opposite of big government. In this case, this is big corporations using the patent system to deny people care. And Democrats and progressives are coming in and saying, no, let's give people other options. So I think that there's a lot of reasons to believe that this is going to cut across the traditional partisan lines that have sort of been entrenched and allow Democrats to make headway in difficult environments.
And by the way, as you probably know, Representative Lloyd Doggett, who I covered his bill for The Nation, he has a bill to introduce what you just described, compulsory licensing, which basically says if a drug company can't see its way to making an important drug available to the public at an affordable rate, compulsory licensing is the term that's been used to say, as you say, let other people manufacture the drug at lower cost, take away that patent exclusivity, that kind of monopoly that the government grants. But Doggett's little twist is he doesn't call it compulsory licensing, he calls it competitive licensing, thereby tapping into, an American free market trope, which I had to admit I thought was clever of him. So have you thought at all, Shauna, this is kind of an off-the-wall question, so you don't have to answer it if you don't want to, but there are a lot of institutions that I personally hate that other Americans don't necessarily hate, right? Maybe other leftists do or other progressives, but everybody hates the drug companies. And it pleases me because I think they need to be brought under, we need to do something dramatic with drug care. But have you ever asked yourself, why do people hate drug companies so much when, not that they're not worthy of hate, but so are other people that seem to get away with it?
Yeah, I mean, I think there's a couple things. And actually, I recently gave what we call in New York City drunk TED Talks, which was where I gave a TED Talk after taking 4 shots. And the case that I had to make was the case to abolish capitalism. And I actually focused there on the pharmaceutical industry because I thought it was the strongest place to make the case of the fundamental, first, predatory nature of capitalism, which is the profit, in this case, of people's illnesses. And specifically when we're talking about the sort of pharmaceutical drugs that are not that we need generic options for. These are normally, we have to do compulsory licensing, we have to do competition, because drug manufacturers are taking advantage of the fact that there are a relatively small number of people who are suffering from these illnesses. So they're really making money in an incredibly morbid way. But the other thing that I think it gets at is the parasitical nature of these sort of corporate capitalism. These companies, there was actually a recent study done that shows that virtually every drug that has been brought to the market over the last few decades was developed in part due to National Institute of Health funding. And so the argument that we have, and we're rolling out some broader policy stuff very soon, but is that from the beginning to the end, this should be an entirely public process. The government should be doing the research. The government should be manufacturing the drugs. The government should have the patents. And so we have a couple of plans that we tested. One is actually a proposal that was introduced by Elizabeth Warren, which is generic manufacturing of drugs, and then one which was introduced by Senator Bernie Sanders, which was a proposal that gives people, scientists, researchers, prizes for making innovations, that if they get the prize, then the patent is owned by the government. So you have the incentive to develop the drug, but you don't have the incentive to jack up the prices of the drug and profit off of death. So there are an incredibly wide range of tactics that Democrats and progressives can use to approach the question of drug prices. All of those policies are popular. So the question I think that we have to start answering next is, what is the most effective way to get something done in the near future that can benefit Americans? And the last thing I'll say is that I know a lot of Democrats have been looking at Colorado Senate. I know a lot of Democrats have been looking at North Carolina Senate. People want to take the Senate, and that means we have to expand the map. And Cory Gardner and Tom Tillis are two of the sort of most slavish devotees of the pharmaceutical industry. The pharmaceutical industry is bankrolling those campaigns. So the more that we can have a message in the House, the better chance we have of both taking the presidency and also being able to have the 51 votes that are going to be necessary to implement an agenda.
In other words, don't nominate yes, okay, I get what you're saying. These vulnerable Republicans can be beaten on the issue of pharmaceuticals. And since people are so open to pretty progressive solutions on pharmaceuticals, maybe they'll be open to my idea, which I've had for a long time, which is seizing the homes of drug company executives and using them to provide rehab services to opioid addicts. I feel there would be a symmetrical justice in that, but I don't particularly expect Democrats to embrace it. So as you look at the kind of array of options you guys offered in your polling, would you just pick them based, if you were suddenly doing drug policy for Democrats in the House, let's say, would you just pick the ones that were most popular and start there, or would you pick the ones that were most innovative and start there? Like the public manufacturer, I love that. The idea that the government already does the research and development for a lot of these drugs, therefore develop the drugs, manufacture them in the public sector and so on. But would you start with something transformative like that? Would you start with other ones, or would you just kind of continue the research process so that we understand better what motivates people?
Yeah, what I'll say is that, the sort of longest held position within the Democratic Party and the progressive movement broadly has been allowing Medicare to negotiate directly with pharmaceutical companies on the drug prices. I think that the sort of generic competition, that's how I sort of frame compulsory licensing, is a very important new idea. And I think that the generic manufacturing is also an important new idea. And I would say that given what we're seeing in the numbers, we should go with what's going to work best, because the thing that people mostly think about is public opinion at the day the bill is passed. And what we've seen over the last decade in the Democratic Party is we actually need to think about public opinion for the years after it's passed. And when we have something like generic manufacturing of drugs, like government research into drugs, people can see the way that the government is directly benefiting them in an incredibly real way. They know that their drugs are coming from the government. They know that their drugs are coming from government research, and that makes them more supportive of government spending more broadly. So I would say that given that most of the interventions that we could end up passing, and I only say most because I only know the ones we've pulled, to reduce pharmaceutical drugs prices are going to be popular. Why don't we do the one that is going to be the most effective in creating a long-term, durable public support for government intervention in drug pricing?
That's a good answer and a good way of looking at it. So I appreciate it. And I appreciate the great polling that you guys at Data for Progress did with Social Security Works. So Sean McElwee, co-founder of Data for Progress, thanks for doing that work and thanks for coming on the program.
Absolutely.